بسم الله الرحمن الرحيم والصلاة والسلام على أشرف المرسلين عليه وعلى آله وصحبه أفضل صلاة وأجل تسليم. Assalamu alaikum wa rahmatullahi wa barakatuh. Thank you very much for inviting me to this session, and it is my pleasure to use my job as a psychiatrist, to use my job as a tool to try to help the Muslim community everywhere. So I'm happy to be with you, and I'm happy to answer all your questions, and I hope this kind of knowledge and information to be helpful for all of us, and may Allah accept from myself and from everyone who is here. Ameen. The topic that I'm talking about today is about adolescence, and first of all, with regards to adolescence, this is a map of the objectives that I'm trying to achieve through this kind of presentation. First of all, I will provide some information about, or introduction about, the definition of adolescence, stages of adolescence, and the psychology of adolescence. Then we will talk about what adolescence like, and why adolescents sometimes seem to be as if they don't listen to us. And then there's another section about adolescents and special needs, for adolescents who have some special kind of disabilities and stuff. Then we will talk about parenting styles, different kinds of parenting styles. What is the best parenting style that can work the best for adolescents? And then we will talk about, there's another section about keys for effective communication, how to make our communications as parents quite effective in communicating with adolescents. The last part will be a general introduction or general view of the general psychiatric disorders that start during adolescence, and what are the red flags, what should we watch for, and what should we do when we see any signs of early psychiatric disorders. In psychiatry, we call psychiatric illnesses, like we call them disorders. We don't call them diseases, because the exact cause of the disorders of the psychiatric illnesses is not fully known or identified. It is not the same like, for example, typhoid fever. Typhoid fever, we know what causes typhoid fever, so we call it a disease. But in psychiatry, because we don't know what's the exact cause of depression, for example, we call it depressive disorder. So first, regarding definition of adolescence, adolescence is not equivalent to puberty. Puberty is just one part of adolescence. It is the initial start of the adolescence. And adolescence in general is a stage of development, or the age between childhood and adulthood. It is characterized by significant changes in the human body. Not only the human body, but also the human brain and mind as well. So there are physical changes, cognitive changes, emotional and social changes. Cognitive means the way of thinking. So the typical age ranges from 10 to 19 or up to 21. So we are talking about the age from 10 years up to 21. The first part from 10 up to 13, 14, this is the puberty. It is just one part of adolescence. So we call it, from 10 to 13, we call it early adolescence. From 14 to 17, we call it middle adolescence. From 18 to 21, we call it late adolescence. So with regard to early adolescence, this is usually what represents puberty. Puberty, when we see rapid growth physically and hormonal changes and all the changes that you are aware of with regard to males and females. At the level of cognitive, the way of thinking, so there is some changes in the way that adolescents would use, like we see a shift from concrete thinking to abstract thinking. Concrete thinking, that's, that you need to see things in order to think about it. But abstract thinking, you don't have to see things to make some abstract understanding about the deeper meaning of things. With regard to emotional changes that we see a lot of mood swings. We see a lot of kind of desires that adolescents would have. For example, desire for independence, desire for autonomy, and so on. In the middle adolescence, the physical growth would continue. The cognitive development also would continue in the same way. With regard to the emotional part, the identity starts to be. The identity starts to be more well formed. So overall, the psychology of adolescent psychology is we have psychology and we have psychiatry. Psychiatry, it is a science that deals with normal behavior, normal way of thinking, and emotions. It's a study of the normal emotions of human being. So whatever normal is related to what we call psychology. Psychiatry is whatever abnormal, like disorders and disease and so on, and how we diagnose them and how we treat them. So there are different kind of psychological schools that try to explain what exactly happened to a human being across different ages, including the age of adolescence.
I think it's pretty loud, so it's better to usually put it here, so it's gonna work for sure. Yeah, it's gonna work.
Okay.
Yeah, we can hear you.
So the first school is what we call Jean Piaget's school. Jean Piaget is a Swiss kind of psychologist. He has a very famous theory about how cognitive processes of adolescence start to develop and how it develop and continue to change over age. He divided his theory into 4 stages, like sensory motor, pre-operational, concrete operational, and formal operational. We will not go through all these kind of stages, but we will focus on the formal operational stage, which is from age 11 up through adulthood. During that stage, he noted that there is a very important change that happens in the way of thinking, which is a change from concrete thinking to abstract thinking. Children younger than the age of 11, younger than the age of 10, in order to say to them like 5 plus 5 is equal to what, you need to give them like 5 cubes, another 5 cubes, and ask them to count them. This is what we call concrete kind of thinking. But for abstract thinking, when they start to learn x is equal to 2, y is equal to 3, then 2x plus 3y is equal to what? Then they have to use their imaginative thinking and abstract thinking in order to know the answer. This is what is the meaning of abstract thinking. This abstract thinking is important to help them understand the deeper concepts, like in religion and in different aspects of life in general. In addition to the abstract thinking, they start to be able to solve problems, they be able to understand the deeper meaning of certain big concepts like justice, freedom, morality, and so on. They become able to make hypotheses and start to make reasoning and problem solving and all this kind of mental processes, which cannot be available before the age of 10. They start to evaluate the logic of verbal statements without real world examples. They don't need to see things in order to make mental processes. So in that sense, the formal operational stage of development during adolescence includes the abstract thoughts, includes the ability to understand logic and make hypothetical reasoning, make systematic analysis of things, put a hypothesis, test the hypothesis, whether it is right or wrong, and so on. This is considered the essential foundation of adult cognitive abilities. Then, this is a different kind of school called object relation theory.
for a certain psychoanalyst whose name is Melanie Klein. Melanie Klein is the one who formulated this kind of theory. The core idea of this theory is what happens early in life during childhood is what shapes how we react to as adults, how we react to other people as adults. So the relationship between a child and his mother in specific is what shapes how this child will react and deal with other people when this child gets older. So they focus on what we call pre-verbal stage in the first 2 years, when the baby is still not able to talk and so on. So the memory starts to work from around the age of 3 to 4, but it works for historical events. Before age 3, there is still memory working, but it is mainly for emotions. So what happens in the interaction between parents and children at that age is registered and stored in their brain in a certain way in the form of feelings. For example, a baby is crying because he is hungry, then the mother starts to feed him, then he becomes quiet. So when the baby starts to cry and the mother does not respond right away or after a relatively long time, then the message that gets stored in the brain of this child is the outside world is not trustable. Those people around him is not trustable. A message of mistrust is registered in the baby's brain, and so on. So we do emphasize the importance of paying attention to how we deal with babies even during this early age, in order to make sure that they don't get this kind of negative kind of conceptions about the world around them. And by the time mothers get to know why the child is crying, so what we call emotional attunement. This is the same like when you enter your car and your phone starts to synchronize Bluetooth with the sound system of the car. Something similar to that happens between mothers and their babies. How they synchronize with the child. The child cries sometimes, then the mother knows, oh, he is hungry, he wants to be fed. Or he cries another time, oh, he is not hungry, he wants the pampers to be changed. He cries again, but he doesn't want any of those, but he just wants to be held like this. You can see the baby after the mother fed the baby, then the baby and put the baby in bed, then the baby starts crying. Then she holds him back, then he stops crying, as if he wants to be held like this. And his need to be held like this is the same like food. So it's very important to respond to the baby's needs in order not to let negative messages get registered in the brain of the baby. So the way how we treat our babies is how we see them during adolescence and how we see them doing during adulthood. So it is important to start early on, since early childhood, how to care about our children at this early age of development. So, and based on how they have representation about the mother and the father and every significant other around them, their personality starts to be shaped. Any conflict during this early stage of development will affect them during the stage of adolescence and even during the stage of adulthood. For example, a child who was abandoned from his mother, put for example in foster care, and struggled with some kind of abuse or neglect during childhood, I wouldn't be surprised to see him during adolescence being unable to have trust in others. And the same would happen during adulthood as well. Cannot put trust in his wife, cannot put trust in his friends or in anybody, because the way how the child was shaped, how this person was shaped during early childhood has stayed with him until later age. But this is treatable, and this is something we can identify and work with through different kinds of psychotherapy in order to help them reformat their brain in a way that can be more positive and get rid of this kind of negative conceptions over time. When we mention brain, brain is the same like the hardware of a laptop. When we mention the word mind, it is the same like the software that is installed on the laptop. It is something that you cannot see, but this is what we refer to as the mind. And the mind is related to certain parts of the brain, and it is connected to certain areas of the brain, but not every part of the brain. This is the core idea of the theory of object relations. Then another theory about Freud, he mentioned a lot of things. He talked about the mind being divided into three parts: conscious, reconscious, and unconscious. He simplified the mind as being like an iceberg. The part above the water is the consciousness, the part that deals with reality and what is going on in our real life. Then the unconscious part is something you are not aware of. We are not aware of. Something related to our past experiences from childhood and so on. There is an area in between. Certain information stays in this area. Sometimes it goes to consciousness. Other times it just goes deeper into unconsciousness and the person is not aware of them. So he also divided the mind into id, ego, and superego. So id means the instincts, the mere instincts like sexual desire, desire for having money, hunger, thirst, this kind of basic instincts. And the superego on the other side is a moral system that is formed in the human mind from early childhood through parents, through society, and so on. The ego is in between. The ego is what mediates between the instincts and the superego. For example, I will give an example to just make things more easier to understand. So somebody saw a car in the street. The car is very nice car, very expensive car, very luxurious car, and then the id or the basic instinct, oh, I want this car. So if this person starts to behave based on id, he will just steal the car and take the car. But when the person starts to work based on ego, the ego says, oh no, you cannot do that, because the super ego says this is wrong and this is not allowed and you will be in big trouble if you do that. This is a super ego. Then the ego tries to mediate between both. Say, oh, you can have another job, a job and another job, so you have two jobs, then you can save more money and you can be able to buy a similar car. You better buy it so you don't get in trouble. This is what the ego part of the mind would work. This is how it works. So the ego is the wise part of the mind that try to mediate between what you need in terms of id and what you have to do in terms of superego. In Islam, as you know, the ego strength is getting stronger, and we get exercises how to keep our ego strong every day by our practices in coming for salah against what you need. Your id wants you to sleep at night, but you get up and come to the masjid to pray. In Ramadan, you want to eat and drink and so, but the ego say, oh no, we have to fast. So we have in Islam exercise how to keep our ego strong in controlling our behaviors and our actions. So the way how you can identify whether the intention inside you is based on id or ego is there are certain signs how to know that. If you feel under pressure to act in certain way and immediately, this is most likely driven by id desire. And it's better for you to wait and not to act, because most likely you will regret what you will do. But the action that comes from ego and based on ego is usually there is no such pressure and it takes time. So it's better to act based on ego rather than being driven by id desire. And so maturity of persons in general, whether adolescents or non-adolescents, depends on how strong this ego is, the ego part of their mind. This is according to the theory of this Freud theory. So, in other words, I would say id is equal to instincts, superego is equal to morality and religions and rules and stuff, and the ego is a mediator between the id, superego, and the reality. What is acceptable and what's not acceptable. So, regarding the psychodynamic development of adolescents or the way how they develop, it depends on the family in the first place. Number two, it depends on peers, friends, and it depends on culture and society that children grow up in. So influences usually comes from the family dynamics, the way of attachment, the way how we deal with them, peer relationships, and along with the cultural and societal kind of norms. Here we go. Coming to this part is really interesting. The narcissism and adolescence. This man is called Heinz Kohut. He is a psychoanalyst as well, and he spent a lot of his life talking about narcissism and how to understand narcissistic personality disorder and so on. So narcissism is not a bad word. Narcissism, or in Arabic, an-narcisiyya. It's not a bad word, but it is just a descriptive term. So there's difference between narcissism and narcissistic personality disorder. Narcissism is self-love or self-obsession. During adolescence, children go through a certain stage of temporary narcissism. They become too self-conscious. You see them in front of mirror often, looking at the mirror. Boys go to gym and come home and try to see their muscles, how big their muscles are. You know, this is a kind of narcissism, but it's normal, completely normal. Girls might do something different, might become obsessed about how they look like, their appearance, how their hair look like, and try to put it in different ways, and so on. So the narcissism comes from a Greek kind of story about certain adolescent whose name is Narcissus. This guy, his name is Narcissus, according to this kind of story, for a Greek story. So he was obsessed with how he looks like, was looking at a pond in the water, and he liked how he looks like and how his face looks like in the water, became obsessed with that, and spent a lot of time looking in the water, up to the point that he ended up drowning in this kind of water. And that this is where the term comes from. His name is Narcissus, and the term came as narcissism in relation to that. So it's a normal developmental stage during adolescence, and it helps foster self-esteem of adolescents when we support them and see them in front of the mirror, testing their muscles and so on. We say something, mashallah, mashallah, you're strong, mashallah. This is foster more self-esteem in them and helps them actually benefit from this stage in a positive way. So we call it pathological when this narcissism goes to a severe extent. We call it pathological. When it becomes pathological, when it becomes too rigid and too severe, to the point that it affects others. When you put others down and you see yourself better than others and you act as if you are better than others. Oh, now we say, oh, that's too much, and now you are getting into what we call pathological narcissism. So this kind of narcissism stage helped them to develop their personality, to develop their self-esteem and sense of self-worth. Now, let's move to the next part, which is what do adolescents like? Based on this kind of introduction from this psychology, in order to try to understand the coming part, we want to know what do they actually like. Number one they like the most is independence and autonomy. independence. They like to be independent. They like to be separate from their parents. They like to be able to do things like their parents. Autonomy means the desire to make their own decisions. They want to take their own decisions, make their own decisions by themselves, and so on. This is a step forward. It's a good thing to see your child wanting to be independent and to have a different opinion and try to justify their opinion, you know. You find your son in the summer, for example, wanting to work, and he doesn't need the money, but he just wants to work because he wants to feel that he is able to get the money. This kind of feeling in itself is what makes the adolescent feel satisfied. Peer connections, you will find your adolescents probably more connected to their friends than their parents. They start to spend more time with their friends. And they like to fit in the group where they are socializing with. This is, again, it's a normal stage of development, and it shouldn't be something that we worry about, as long as this kind of group of friends are good friends and they are in the right path, supporting your children. So it's completely normal to see your adolescents absent from family meetings, and they spend more time with their with their friends. They like technology and media. Of course, we like to have some kind of supervision over that to make sure that it is used in the right way. They like creativity, self-expression. They like adventure, fun. They like recognition and validation, and this is very connected to what we just mentioned about narcissism during adolescence. Recognition means you just need to say, "Oh, mashallah, you are grown now. I see your beard. I see your mustache. Mashallah, mashallah, and I see your muscles. You're very strong." So this is what we call recognition and validation. So when you appreciate this kind of changes in them, you are more connected with them, and they feel good about themselves. It helps them develop better self-esteem. Then sometimes adolescents might look like as if they don't listen to us. Are they really not listening to us, or is this right, or this is just a misperception from parents? So let us talk about the brain development. Brain development, there is an area of the brain, we call it the prefrontal cortex. The prefrontal cortex is this part. This part is not fully developed during adolescence, during this age. This prefrontal cortex is responsible about judgment and impulse control. So it is not surprising to see adolescents don't really appreciate the consequences of their actions. They don't see the consequence. They want to do this and to do it now, and that's it. They don't see what's behind, what can be the result of their behavior. So the impulse control is not that great at that age. At the same time, the limbic system is another part of the brain, but it is more deep in the brain, and it is related to emotions and reward seeking. This part is very active during adolescence. So it is not surprising to see them having strong emotions, very strong emotions. At the same time, they don't have good judgment. They don't have good impulse control. Then it's easy to see their emotions override their logic. So they definitely would need some guidance, but they need some understanding from parents as well regarding this kind of brain development, so they can understand why they feel and behave and think the way how they do. Number two is search for independence that we just talked about. They are searching for their own identity. They want to be separate. The son is wanting to be separate from the father. The daughter wants to be separate from the mother. They want to be independent. They want to form their own separate spatial identities. So search for independence and the desire to search for independence might make them look like as if they are not listening. But the other side of that is the search for independence, the strong desire to be independent. So they look to us as if they are not listening. Then the cognitive style, early adolescents think concretely. They have to see things in order to be able to make calculations and stuff. And they struggle with long-term consequences. because the abstract thinking might not be well formed yet. The abstract thinking is about how to see the consequences, the future consequences of your actions. When this abstract thinking is not well formed yet, then they might have some kind of struggle with the continuation of some kind of concrete thinking to a certain extent. So when they are stuck this way with the concrete thinking, not thinking ahead, not being able to see the consequences, they might look to us as if they are not listening. But it is just their brain. This is the way how their brain is. Then the emotional states, we see a lot of mood swings and we see a lot of emotional reactivity. Their emotional reactivity is quite intense. And because of this intense emotional reactivity, that might be perceived as they are not listening. But it is just they are driven by strong emotions. Their emotions are not like our emotions. Their desires are not like our desires. Because our brain development now, the prefrontal cortex, is much more advanced than their prefrontal cortices. So criticism, for example, they can be very sensitive to criticism. And when we criticize them, especially in front of others, it can be quite devastating to them and they can easily shut down. So we need to be very careful about criticizing them, especially or giving them feedback. And I will tell you later in the coming sections how to provide a more kind of safe and helpful, constructive kind of criticism. Then the peer influence. They have a strong desire to be connected to their peers and to fit in. They might try to have haircuts in a certain way that fit with the group. They might try to have certain kind of dressing related to the way how other peers use like a certain kind of jeans and certain kind of clothing, you know. There is a strong desire for peer approval. They don't want to be isolated from the group. They want to fit with the group. So they have to do what the group is doing. So as long as they are with a good group, we should not worry about this again. Yeah. So the communication style, it really matters. And the communication, how we communicate with them. Usually giving them like one choice, you have to do this, or commands, you have to do this, does not work so great. It would be better to give them choices sometimes, to try to work with them in a collaborative way. So for example, let us sit down and talk about this. What are the options? What are the different options we can think about this matter? Even if you know what they should do, but giving them the chance to participate in the discussion in a way of give and take, you know, and try to listen to what they take in a respectful way, that can be more effective rather than lecturing them. Lecturing them is not helpful. To give them lectures every day, that's not helpful. It's better to give them more choices, engage them in a discussion. And there is something in psychiatry we use with patients sometimes during psychotherapy, what we call Socratic dialogue. Socratic dialogue is when you talk with your child in a way and ask him a question and you want to tell him the answer of this question. For example, you can say your child is insisting to ride his bike without a helmet. And then you say, what do you think might happen if you fall down? Then he will give you a certain answer. Then this is actually what you want to tell him, that you will get hurt if you ride your bike without a helmet. If you fall, you will get hurt, and so on. So you just say to him, oh, what do you think might happen if you ride your bike without a helmet? What do you think might happen? Can you tell me? You know, you're talking with him like this, asking him questions. The answers of these questions are what you actually want to tell them. But when it comes from them this way, it becomes more effective and they accept it more. So here are the main points. So now adolescents actually do lessons, but they listen differently, and their response is shaped by and controlled by the brain development, the independence needs, the cognitive style in terms of where they are in terms of concrete thinking versus abstract thinking, emotional state, how strong their emotions are, how intense these emotions and mood swings are, the peer influence, what kind of peers they are connected to, and what kind of communication style we as parents have with them. So this part, I just had this presentation with another group of Muslim community. It's about adolescents with special needs. So is this something that would interest any of the attendants now?
No.
No? Yeah? Yes or no?
Yes.
Yes. Okay. So when adolescents have special needs, like for example ADHD or having autism or mental abnormality or something, they go through the same changes that we see in other children as well. But there is something that would characterize those groups to a certain extent. They can be at high risk when they are allowed to be independent. They might struggle more with being independent because they have some kind of limitations. So they need more guidance, they need more support, more supervision in order to make sure that they are safe. So they might need a lot of education, more education than usual. For example, in females, for example, starting to have menstrual period. Menstrual period is a cycle every month, a monthly cycle for women. They might need more education about what that is and how to care for themselves and what kind of hygienic and stuff they can use for that stuff. They can be at increased vulnerability during physical care if they are quite limited and they need assistance with personal care. During this kind of personal care, they might become more vulnerable, and the problem with those group is they tend to act their feelings. So instead of talking about their feelings, they turn their feelings into behavior, actions. They might start to be aggressive, they might start to be irritable or agitated, or they start self-injurious behavior like head banging or cutting themselves. They might not sleep well at night, they might have changes in appetite, refusing to eat, or eating more than usual. So, they are vulnerable in other ways, like with regard to bullying. They are usually targets of bullying. We need to watch for that, be in contact with the school, make sure that they are not. Now, all this is about children with special needs, like disabilities. So during the age of adolescence, they might be targets for bullying at school, social isolation. Their desire to fit into the group might lead into some kind of risky behavior sometimes. And this part is very important, that the sexual development during the adolescence, they might become very sexually curious to the point that they might not respect the boundaries. They might not know what should be done, what should not be done in public. They might act in an inappropriate way in public settings, like this setting, for example. So they need more supervision. They might not be aware about the boundaries, what should they do, what they shouldn't do. And if you see them starting to show some kind of sexualized behavior, this is very, very important. That might be a sign of possible abuse. So if a child like that starts to do some kind of sexual behavior or sexual movement or something, then you might wonder, oh, how did you know that? Where did you get that from? And then you need to inquire right away. This is considered a red flag that the parents should capture right away and try to explore. So another red flags for those age group with this special population is unexplained injuries. When you see unexplained injuries in those children, you need to find out how did that happen. Bruises in their bodies, in certain parts of their bodies. How did these bruises happen? How did these abrasions happen? So then if they start having fear of certain people or fear of certain places, all of a sudden, then that can be a red flag as well. Sudden behavioral changes in general, refusing to sleep, nightmares, refusing to eat or eating too much, or trying to talk about something sexual knowledge beyond their developmental age. They mention something, oh, how did you know all this? You should wonder about that. And where did that come from? This age group and this population have certain kind of communication. As I said, they don't have the capacity to verbalize their emotions. They don't have the capacity to put their emotions in words like others. But they act through behavior. So they might look distressed, they might look aggressive, they start slamming doors, they head banging, cutting themselves, increased frustration, shutting down. Always, we as parents should ask ourselves, what does this behavior communicate? What is the meaning of this behavior? And we have to see what is happening prior to that. What was the trigger for that? Then we understand, what does this child want to communicate to us? Their desire to be independent is still there, but we need to provide them with more support, more supervision in order to make sure that they don't get into kind of risky behavior. The family with the children having some disability, they are at risk of burnout, and they need a lot of support, especially during transition of care. So children who reach the age of 18, prior to the age of 18, in the medical system of Canada, they are under care of a pediatrician, the doctor for kids, or a child psychiatrist. But once they reach the age of 18, they have to be transferred to an adult psychiatrist. During this transition, they might stay on the waiting list for a relatively long time. So that can be quite stressful to the family. So they need to prepare to this kind of transition early on by communicating with the family physician to arrange for the transfer early on, early enough before the age of 18 in order to avoid staying in this kind of transition stage for a longer time. So to avoid gaps in healthcare and support. They need like consistent routine can be quite helpful. Clear supervision, support, identify safe adults. You tell them when you have trouble, you go to this person, or this person. So identify safe adults for them to go to when you need help. Some of them might need some trauma-informed care based on what kind of trauma they are exposed or were exposed to. Repeated education in a simple language is also needed. Again, behavior in this age, in this special population, is often the language of distress. They don't dismiss changes as we should not refer everything they do to just adolescence and adolescent changes. There might be something extra behind the scene that we are not aware of that we need to understand. But overall, support is needed, more support is needed, more education is needed. Now, we talk about parenting styles. The way how we communicate as parents with children, there are different kinds. And what is the best way? So, the first one is what we call authoritative. Authoritative is a good word. It's not a bad word. Authoritative means a parent who allows his children to discuss things with him, and there is kind of open dialogue about things, but at the end of the day, there are red lines we cannot go beyond. Here is what's right, here what's wrong. We are Muslims, this is what we should do, this is what we should not do. But we allow certain kind of discussion. We don't come to this right away. We allow certain kind of discussion, open dialogue with them. Let them express their thoughts, their ideas. But at the end of the day, we have red lines. We cannot go beyond this. We are Muslim, we cannot do this. We cannot drink alcohol. We cannot do this, we cannot do that, and so on. This is what we call authoritative parenting style. The second one, what we call authoritarian. This is a bad word. It's negative. Authoritarian means you have to do this, and only this. This is what you have to do. You must do this. That's it. No other options. This is what we call the authoritarian attitude. Authoritarian parenting style is not helpful and usually leads to children start to lie to you, children starts to do many kind of psychopathic behaviors or antisocial behaviors, and it's not recommended. A quote from psychologists and psychiatrists, is not recommended parenting style. The third parenting style is permissive. Permissive is you do your homework or you don't do your homework, it's not a big deal. But for the authoritative, no, you need to do your homework, and if there's some difficulty, let me know what's difficult so we can work together. I can find you some help. You know, that's the authoritative one. Authoritarian, oh, you must do your homework right now. So permissive, you do it or you don't do it. It doesn't matter. The fourth one is the neglectful parenting style. They are not aware about what the children are doing, and they don't actually care about what they are doing, whether it is right or it is wrong. So as you see, the first one is the only one that's recommended, the authoritative one. The authoritarian, the permissive, and the neglectful are definitely not recommended parenting styles. I'm happy to circulate all these slides to brother Tariq, and he can don't worry about it. So with regard to keys to effective communication with adolescents, there are certain keys. This is very important section of this presentation. Number one, building trust and respect. We, in our practice as a psychiatrist, we cannot help any patient if we don't have a relationship with the patient, a doctor-patient relationship, a professional kind of relationship. This relationship has to involve trust and respect. Without having trust and respect, it's very difficult to communicate to your child, your adolescent, any kind of material or information you want to pass to them. So we do care about try to build trust and keep the respect and keep it all the time. Respecting their privacy, ensuring safety, giving some responsibility to build trust. You allow them to do some stuff on their own. You allow them to do some planning. We are going to camp next week. Let us prepare our stuff. We are going to travel to Pakistan next month. Let us try to look for a good flight at a good rate. Help me with that, you know, something like that. That involving them this way can help foster a good relationship with trust and respect. The second thing is listening, acknowledging, and open communication. So Freud, that we just talked about, noticed something. When he allows his patients to talk, they feel better. And he called that talking cure. Talking cure. So this applies very similar to that concept. Allowing someone to talk about their feelings, make them feel better. Regardless, you agree with what they say or you don't agree with what they say. Just give them a chance and to talk, and they turn their feelings into words that gives them relief. There is a common saying in Arabic. It's called الحزن الذي لا يجعل العين تبكي يجعل الأعضاء كلها تبكي وأحيانا تدمي. This means in English, if you have certain emotions or sadness and you don't put it in words or you don't cry about it, it turns into your body and your body starts to talk about it. And the language of body is pain. You will feel pain everywhere and you don't know what is causing this pain. You go to the family doctor, he does blood work and x-ray and so on, and they don't understand what is the cause of this pain. It is emotions that is present inside you, and it is not turned into kind of expression, either by tears or by talking or so on. أحيانا تدمي, sometimes the body starts to bleed. This is in women. When they have such kind of sadness, they don't talk about it. They might start to have the menstrual cycle at a different time. They might start to have bleeding and what we call dysfunctional uterine bleeding. The doctor does a lot of investigations, blood work, x-ray, ultrasound, and there is nothing. It's just dysfunctional and you try and bleeding. And it is because of hidden sadness that is not put in words, that's not expressed. So likewise, in adolescence, allowing them to talk give them relief, a lot of relief. So, but listening to them in a non-judgmental way promotes them to talk more and to share with you more. But if you become judgmental, they might start to hold back and hide certain information and not sharing much. So it's important to be non-judgmental, allowing them to talk and express themselves freely. Again, offering choices rather than one-way order, one-way command is highly recommended. What else here? So avoid power struggle and try to collaborate. Try to negotiate with them instead of imposing your rules. So it's something of open dialogue is much better than imposing certain kind of rules and stuff. So, for example, you say, let us decide together. Let us think together. They love to hear this together. They seem like my patients. Patients, they love to hear together. Let's work together on this. You are not alone. I'm glad you are here. I will do my best to help you. Let's think together about how to help you. Let me understand first why you are here. You see what I mean? So likewise, adolescents, I'm not saying that they are patients, but taking this kind of skill from my practice to apply with adolescents can be quite helpful. They love to hear together, let us think together. It conveys collaboration. It conveys that you approve them as persons and separate persons. You approve that they have separate kind of personalities. You acknowledge that and you respect that and you respect their mind and their opinions. And allowing them to talk this way, you know, they might come to the conclusion that you actually want them to come to. Support and encouragement. As we said, they love support, they love praise, they love encouragement. If you remember this part of the narcissism, the being too self-conscious during adolescence, when you give them some praise and some good comments, you know, it fosters more self-esteem and empowers them as well. Increase their self-confidence. Empathy. So empathy, again, Heinz Kohut spent a lot of his life talking about how important empathy is. And I will come to the exact definition of... even he died because of cancer. The last lecture he had on YouTube, it's available on YouTube, it's about empathy. And it was around 3 days before his death. So empathy is defined as understanding and appreciating someone else's feelings. So empathy is not feeling. Empathy is not a feeling. When you become empathetic, that does not mean that you have certain feelings in your heart towards some person. It just means understanding and appreciating someone else's feeling. This is what we use every day with almost every patient in the clinic. It's a very important skill and very effective way of communication. So there is another word that is very similar and close to this word, close to empathy, what we call sympathy. There is sympathy and empathy. Sympathy is something different. Sympathy is when you see someone struggling and you feel sorry for them. You feel something. You driving your car and you saw a very bad accident on the road. Someone is killed on the road and he's very damaged. His body is very damaged. Oh, you feel very sad about that. So this is what we call sympathy. This is not going to help that person. What actually helps is empathy. Empathy is when you convey to the other person that you understand and appreciate their difficulty, their experience. So empathy, when you react with the other person at the level of your mind. Sympathy is when you react at the level of your heart. At the level of your heart is not going to help. At the level of your mind is what actually will help. So in our practice, and every day, we use empathy. Sympathy would lead to burnout. If you become sympathetic, you will get into burnout right away. That's why in Canada, they say, doctors should not treat family members. I am not allowed to treat a family member. My brother, my sister, my wife, I'm not allowed to do that. Because of what? Because of sympathy. Sympathy is unavoidable, but empathy is a matter of choice. You choose to be empathetic or you choose not to be empathetic. But sympathy is unavoidable. So, for example, why they don't allow physicians to treat their family members? Because of sympathy. What is the problem with sympathy? Sympathy will lead to something what we call impact on clinical objectivity. Clinical objectivity. If I treat, for example, my mother, for example, my mother has some swelling here, then I will be more inclined to have a simple diagnosis. Oh, it's some inflammation. It's something simple. I will be more inclined to think about something simple with a simple outcome. But I wouldn't be more inclined to think about cancer. You see what I mean? I might neglect cancer. Automatically, my mind will go away from serious kind of diagnosis. And then I will end up providing the wrong diagnosis because of this kind of sympathy. So again, empathy is what we look for. And empathy is a skill, a fantastic skill in communication between any two persons, whether with adolescents, with adults, with your wife, with anybody. So the way how we do it is we try to listen carefully to the person and try to reflect back what I'm hearing from you. So I totally understand and appreciate how difficult this situation is. And you just talk with that person, and then that way that conveys this kind of meaning. Empathy is very effective, it's very helpful. You remember when you go through some difficult situation and you know you have certain friend and you call that friend right away and you start talking with the friend. And by just talking with that friend, because you know he understands you and appreciates your difficulty, that automatically makes you feel better. Empathy does not necessarily mean or include that you solve the problem of the other person. Even without solving the problem of the other person, just expressing understanding and appreciation of how difficult this situation is for the person, that automatically makes the other person feel better. So so empathy as a tool we should use with our adolescents. Try to when they have difficult situations at school or whatever, trying to understand and appreciate and acknowledge how difficult it is, and try to think with their minds. That makes them feel better. The other definition of empathy is walk a mile in my shoes. That is how they define empathy. I can give another example. I came one day from work and I found my 7-year-old crying, coming from school crying. And when I asked her, why you are crying? That she said, the teacher didn't give me a sticker today. For her, this is very big. But if you take it by your mind, that sounds very silly. But the empathy here is when you try to put yourself in her shoes with her mind and take it with her mind and think about it the way how she thinks about it. It must be very, very hard that she didn't get the sticker today, a big deal for her, So this is what we mean by empathy. Then moving to another skill in communication with adolescents is respecting autonomy and boundaries.